Hi, my name is Sherry Sanders and I'm a county extension agent here in White County as a part of the University of Arkansas System Division of Agriculture. This is Agriculture. This series is meant to empower and celebrate women working in the field of agriculture in the state of Arkansas. This month's feature is Dr. Natalie McDonald. She's a veterinarian and a co-owner of Honey Hill Animal Hospital here in Searcy, and this is her story.
So here at Honey Hill Animal Hospital, we have tried to foster a feeling of family with our employees. We have 6 certified veterinary technicians which have gone on to have additional training. They're not on the job trained, they actually are credentialed technicians. And we have 3 doctors here, 3 veterinarians here. We have 2 receptionists, one of which is kind of an office manager and has some managerial roles. And we also have 2 assistants who work here. And they all come to work every day with a smile on their face, and they are my family. They're my work family. And my husband and I joke that we kind of take in strays and adopt people, and we do the same with our employees. We love them, they're part of our family, and every day we get to come together and help people and help animals. And that's, you know, the James Herriot, all creatures great and small, is written in our lobby, and that's, you know, we kind of try to stick to that kind of old school veterinary medicine, and that's what we want to foster, is that love of animals first and love of people and helping people help their animals. So some of the roles here in our practice, and of course we have our doctors that are responsible for surgery and intensive medicine cases, and we do the diagnosing and the treatment plans, but we also have some people that are kind of behind the scenes roles sometimes, and I think it's so important that we highlight those people and what they do and how they help our animals as well. So I mentioned that we have certified veterinary technicians that work here, and those people have gone through a 2-year program to get that associate's degree and to become veterinary technicians, and then they have to pass a national board exam to become certified veterinary technicians. And much like our national board exam that I had to take, it's a tough one, and they don't, you know, unfortunately not everybody passes it, but it's there for a reason, so that they are able to provide a level of care to animals. And if you want to go a step further, you can become a veterinary technologist, and that's a 4-year degree program. And we have a veterinary technologist here as well. And then there's a step further from that. If you wish to specialize as a veterinary technician, now you can become a veterinary technician specialist, and actually have 1 and maybe 2 technicians here that are working on their specialty in veterinary nursing, and that can be either small animal or large animal. They can specialize in pathology or surgery, much like, you know, we have veterinary specialists, and we have my husband is he does orthopedic surgery, so and he's not a specialist, but he limits his practice to veterinary surgery. But we have veterinary specialists that do surgery. We have veterinary specialists that do ophthalmology and neurology, so eye specialists and brain specialists, and people don't realize that. So a lot of those specialists are at universities, and we get to refer to them for cases that are out of our depth, much like your general practitioner would say, you know, I'm not going to be able to do your surgery, I'm going to have to send you to a surgeon. So sometimes we are able to do that as well with animals. So that's some of the different roles that we have here in our clinic. We love and value our certified vet techs, and their day, it looks a lot different than my day. So my day, you know, I get here and my job is to diagnose and come up with treatment plans. And I utilize my certified technicians to, they do blood draws, they take x-rays, they do lab work, they place all of our IV catheters for any intravenous use for pre-op for surgery, just like you get a catheter before surgery in your arms so that they can deliver drugs. Our patients get that. And those technicians are the ones that administer and monitor our anesthesia. So for all of our surgeries, we have a certified technician that's in the OR with me, and their job is to monitor our patient, keep our patient's anesthetic level where it's supposed to be, and then they also are responsible for recovering that patient. So it's just like a human hospital, everybody's got a role. You can think of our certified technicians as our RNs. So they're, and they can even go, they can go a little step further. They can do small suture lacerations up for us. So they have lots of knowledge, and we definitely utilize them to the best of their ability.